Hi, let's talk all things pubic bone pain today. So I've been hearing a lot lately about pregnant people that are suffering with pubic bone pain. And so this is often called pubic symphysis dysfunction or symphysis pubis, okay? So when the two hip bones come together, there's this little space between that's cartilage, and that's called your pubic symphysis. And that can get irritated as the pelvis begins to open up for delivering the baby. So it's kind of a catch-22. I mean, you want that to happen during pregnancy. You want your pelvis to be able to open, but you don't want the pain at the pubic symphysis. Typically, we see 5 to 7 millimeters of separation at the pubic symphysis, and it can go all the way up to 9 millimeters during labor. So as the baby's coming through the birth canal. So what this means is that this area is subject to pain, inflammation, irritation. And so we want to do everything we can to help prevent that area from getting irritated. So there's a lot we do at the physical therapy clinic to really help reduce the tension there. So we work inside the pelvis and outside the pelvis to help take the strain off that pubic symphysis joint. And that can make a world of difference. So if you have pubic symphysis pain during pregnancy, it's really important to address it during pregnancy, because you not only do you not want to suffer during your pregnancy, a lot of people have trouble turning over in bed. That's probably like the #1 complaint. When you have pubic bone pain, rolling over in bed is pretty awful, to be honest. And so we have a lot of ways we can teach to modify that. I'm sure you can go find some of our videos that show you how to modify that. Also, getting in and out of the car can be really painful on that pubic bone. And so we do a lot of modifications of making sure that you're not like separating your legs, trying to keep your legs semi-close together, but not squeezing them together. And so those are some of the common complaints that we see that are hard. So the reason you want to deal with it during pregnancy is, yes, so you can function during pregnancy and not be walking around like a stiff, wide-legged, waddling pregnant person. But it's so you can also be able to spread your legs for birth, right? So if you go into birth or labor and delivery and you're having a really hard time opening your legs up, it's going to make it hard for you to be comfortable to spread your legs to push this baby out. And so we always teach like follow your body's patterns, and hopefully you have a provider that will help you deliver in whatever position is like comfortable for your body and what's calling you, or like the position that you want to be in. But not all providers are like that, and most people end up delivering on their backs, and just complete honesty, so on their backs and on their sides. And so when the legs are just like held open, that can be even more stressful on that pubic bone. And so people fear C-sections. I've been hearing that a lot lately. It's like, I need to get my pubic bone better so I don't have to have a C-section. And the reality is like, you can do this without, you can have this pain and it can go away, or at least be mitigated enough so you can open your legs to have a vaginal delivery. And the pubic bone pain itself won't be the reason for the C-section. The other thing that's important to know is I've heard a lot lately about how scary it can be postpartum to have the baby and not be able to walk, or have to walk with a walker, or not be able to weight bear, so like put weight on your feet whatsoever, because the pain in the pubic bone is so severe. So yes, that is a fear. That does happen to some people, but there is a lot we can do during pregnancy so we can make that not happen. And part of that is releasing, so manually releasing a lot of the muscles that attach to the pelvis, on the inner thighs, around the hips. And when you do that, it allows the joints to align in the position that they're supposed to be in, and it takes the stress off the joints. So even though your pelvis is getting wider, your muscles don't just like automatically relax when the pelvis in alignment changes. Typically the muscles get tighter and try and hold you together, and that's the same thing that's happening inside the pelvis. So the pelvic floor is contracting, trying to hold you together. So if you're doing Kegels to help this, scratch that. No Kegels. That's not going to help you, especially prepare for delivery. But there are certain muscles that can help hold the pubic bone together. So I highly recommend getting a consultation with one of our pelvic experts at Body Motion Physical Therapy in Edmonds, Washington. And we can definitely help with this pubic bone pain. There's so much we can do, even if you're in your third trimester, second trimester, it doesn't matter where you are in pregnancy, there's so much we can do. The earlier the better, before delivery, of course. But even just a little bit of help can make the world a difference, especially postpartum. So that's what we want for you. That's what we want for everybody. We don't want this pubic bone pain to control your life, especially like labor is hard enough. Like, let's not have this pain. Being a new mom is hard enough. Let's not have to like deal with that right away. So that's what we want for you. That's what we want for everybody. And happy pregnancy and happy birthing to all those people with pubic symphysis dysfunction. So we are here for you. And if you have questions, just DM us. Bye.